Everyone, welcome back to my channel Nursing Guru 24. Today we are talking about something that often makes nursing students a bit nervous in clinical area, that is chest drainage system, or what we commonly call it as ICD, that is intercostal drainage. Intercostal drainage. Inter means in between. Coastal refers to ribs. In between the ribs, we will insert a tube and we will drain the collected waste. That is called as chest drainage system, that we will discuss later. Now, imagine our lungs. They are like balloons inside a cage. Ribs are like a cage. Within the ribs or within that cage, lungs are like balloons. Sometimes what happens due to trauma or surgery? Due to trauma or surgery, some unwanted guests enter the pleural space. Some unwanted guests means either it may be air, or it may be pus, or it may be blood, etc. They may enter the pleural space. Our job is to remove those wastes from this space, because of presence of this air, pus or blood or something else, they alter the expansion of lungs. They will not allow the lungs to expand completely. Hence, we will put a tube here. See, before proceeding with this, what is pleura? What is pleura? See, these are lungs. Just outside the lung, just outside each lung, there is a serous cavity called pleura. There is a serous cavity called pleura filled with pleural fluid. This space is filled with pleural fluid. Then this pleural layer or this serous cavity is consisting of two layers. This is bilayered wall. This is outer layer and this is inner layer. The outer layer of pleural cavity is called as parietal pleura. Then inner layer of pleural cavity is called as visceral pleura. Visceral pleura. Between these two layers, there is a cavity filled with fluid that is called as pleura or pleural fluid, that provides cushion for lungs while expanding. This is brief about the content what we need for studying chest drainage system. Then, what is chest drainage system? Chest drainage system means it is a surgical procedure. Chest drainage system is the surgical procedure in which a chest tube or a hollow tube inserted into the pleural cavity. It is a surgical procedure in which a hollow tube is inserted into the pleural cavity to remove the wastes. To remove the wastes like air, pus, blood or etc. in the pleural cavity, we insert a tube called chest tube. That procedure is called as chest drainage system. Chest drainage system is the surgical procedure in which we will insert a tube into the pleural cavity to remove the air, pus, blood, etc. Presence of air in pleural cavity is called as pneumothorax. Then presence of blood in pleural cavity is called as hemothorax. Then presence of pus in this space is called as empyema. Or sometimes there may be collection of fluid that is called as pleural effusion. Or sometimes there may be collection of chyle, that is lymphatic fluid. What it is called as? Collection of chyle in pleural space is called as. Comment me your answer in comment box. See, chest drainage system is the surgical procedure in which a hollow tube is inserted into the pleural space to remove the collected air, pus, blood, fluid or chyle. Then in which space this tube is inserted? Space. In a pleural cavity it is inserted, but from chest where it is inserted? From chest between 5th to 6th intercostal space. Between 5th to 6th ribs, that is 5th intercostal space. See, it is the chest tube is inserted in a pleural cavity through intercostal space, that is 5th intercostal space, that is between 5th to 6th rib. The space between 5th to 6th rib is 5th intercostal space. Through that space, chest tube inserted into the pleural cavity. Next, we will see how chest drainage is done. See, for draining the chest or for draining the pleural cavity, we commonly use 3-chamber system. 3-chamber system. As the name suggests, this chamber is consisting of 3 chambers, namely first one, drainage collection chamber. Second one is water seal chamber. And third one is suction control chamber. This is optional one. Optional. We may use suction control chamber or we may not. As I told, we use 3-chamber system. The first chamber is drainage collection chamber. Somewhat this looks like this. This is first chamber, this is second chamber, and this is third chamber. First one is drainage collection chamber. Drainage collection chamber directly collect the waste from pleural cavity. That means this tube is directly connected to the pleural cavity. From pleural cavity, this chamber, means that first chamber, drainage collection chamber, collects the waste. If there is pus, it collects the pus. If there is presence of blood, it collects the blood. Then second one is water seal chamber. This one. This is water seal chamber. This should be filled with water. Before using this chamber system, this chamber should be filled with water to 2 centimeter. Here connections will be there. And this chamber is consisting of only one-way valve. this chamber is consisting of one-way valve. This allows only movement of collected waste towards one side. It will not allow to go back. And this chamber is consisting of water, and the water in the sealed chamber, the water in this chamber should rise. The water in this chamber should rise with inhalation. For when the patient inhales, this water level should go up, and when the patient exhales, this water level should go down. That is called as tidaling. What is tidaling? When the patient inhales, the water level should go up in water chamber, and when the patient exhales, the water level should go down. That is called as tidaling. Tidaling means movement of water in water chamber. Then suction control chamber, here we will set pressures. This is based on the condition and amount of fluid collected in the pleural cavity. This is brief about 3-chamber system. Another thing, if water movement in water chamber stops, what it means? It means the lungs might be expanded, or there is kink or coiling of that tube. If there is kinking or coiling of that tube, there will be no rise. There will be no rise or drop of water in the water chamber. Then what are our responsibilities while the patient is with chest drainage system? Our responsibility is to keep the chest drainage system below the level of patient's chest. Why? Because gravity collects the collected waste. We don't want the fluid flowing back into the patient. If we keep the chest drainage system above the patient's level, it will go back. Again, it may cause infection. Then intermittently check for bubbling. There will be presence of intermittent bubbling in water drainage system. Presence of intermittent bubbling in a water chamber is normal one. If there is continuous bubbling in water chamber, if there is continuous bubbling in water seal chamber, that indicates air leakage in the tube. Intermittent bubbling is normal one. If there are continuous bubbling, that indicates air leak in the system. If you remember these basics, you can easily manage patients with ICD. If you found this helpful, please hit the like button and share it with your friends. पढ़ाई करते रहिए and I will see you in the next video. Thank you.